All right. So thank you for joining us for Deconstructing the Preventive Service Codes, Part 2, Transitional Care Management Services. Today we are going to review the CMS preventive visits. We're going to focus on 3 of them for this series. We're going to dive into the specifics of transitional care management services, focus on the coding and billing requirements, and then finally present a suggested best practice TCM workflow, and then answer any of your questions. So as a reminder, when we started this webinar series last week, we reviewed that under the Affordable Care Act, private health plans now must provide coverage for a range of preventive services without imposing any cost sharing on the patients. So what this means is it really encouraged also Medicare to begin paying for preventative visits. So in 2011, they started paying for the annual wellness visit. And we see this sort of focus on directing care to the primary care provider. And then in 2013, CMS began paying for the TCM visit, which we're going to review today, which are CPT codes 99495 and 99496. So with transitional care management codes, we see the focus starting to shift in reducing readmissions. We've directed care to the primary care provider. Now our patient is admitted. Let's make sure they don't get readmitted back into the hospital. And then in 2014, CMS began paying for chronic care management services. Now we're thinking proactively, how do we keep patients out of the hospital? So taking all 3 of these, combining them together, we're focusing on directing our care to the primary care provider, reducing readmissions, and keeping patients out of the hospital. All of this really motivated by these preventive service visits that CMS now pays for. Let's do a quick review of the annual wellness visit. Again, if you'd like to review the first webinar of this series, you may. It's recorded and up on our website. The annual wellness visit is a comprehensive care planning visit that includes various screenings and a health risk assessment. Very important that it is not a head-to-toe physical. It's more of a care planning visit. The physician has a discussion with the patient and makes care plans for the future. So the patient and the healthcare provider create this prevention plan based on the health needs and risks that were assessed during the visit. Transitional Care Management Visit, fondly known as a TCM, is a service provided following discharge, and that can be discharged from any inpatient facility. We'll dig into the specifics there. And it includes both non-face-to-face and face-to-face services. This is important when we think about coding and billing for this visit. This visit is reserved really for patients who have medical or psychosocial problems that require moderate to high complexity medical decision-making. And we'll talk about that in more detail. I would argue that many Medicare patients, especially those following an inpatient admission, probably require moderate or high complexity medical decision-making. And in the TCM visit, the healthcare provider takes responsibility and accepts care of the patient following the discharge. So again, the idea is that we are directing care back to the primary care provider. That PCP is serving as the quarterback, coordinating all of the care, especially after an inpatient stay. And then we have chronic care management. So CCM are non-face-to-face services. So we had AWVs, which are face-to-face, TCM, which is a combination of face-to-face and non-face-to-face, and then CCM, which is purely non-face-to-face services provided to patients who have multiple, which is defined as 2 or more significant chronic conditions. And these services include communication to the patient and other caregivers, also coordination of care with other healthcare professionals who are participating in the patient's treatment plan. It involves the creation of a care plan and also being accessible to the patients 24 hours a day. We're going to dig into the chronic care management visit next week in our last installment of this webinar series. So for our TCM visits, these services are provided during 30 days, beginning on the date the patient is discharged from an inpatient setting. Again, the patient also has to have medical and or psychosocial problems that require moderate to high complexity decision-making. Inpatient settings, in this case, include inpatient acute care hospitals, inpatient psychiatric hospitals, long-term care hospital, a skilled nursing facility, so they can be discharged from a SNF and receive a TCM visit, inpatient rehab, a hospital outpatient observation or partial hospitalization, so that's key there. If they're discharged from an observation stay, that is considered eligible for a TCM visit, or a partial hospitalization at a community mental health center. So any of those facilities, if the patient is discharged from any of those places of care, they are eligible for a TCM visit within a specific time period during the 30 days beginning on the date the patient is discharged. There are 3 required components of transitional care management services. The first is interactive contact. So contact with the patient or caregiver must be made within 2 business days following the patient's discharge to a community setting. So let's say I'm admitted to the hospital on a Friday. I get discharged on Sunday. So my PCP needs to be in touch with me within 2 business days. So by Tuesday, they need to be in touch with me and have interactive contact. Generally, this is a phone call. And if for some reason I'm incapacitated, the phone call can be done with my caregiver. And during this interactive contact, there are a few non-face-to-face services that need to take place. Mostly it's a medication reconciliation. So they want to make sure that their patients are taking the correct medications. They understand what they need to be taking. It's also obtaining a discharge summary or some sort of discharge information. And it may also be interacting with other healthcare professionals who were part of this patient's care during their inpatient stay. So that interactive contact, a non-face-to-face service, is fairly unique for us generally when we think about providing care to patients in the office setting. And then the final piece of this is the face-to-face visit, more of what we're used to. So we have to have a face-to-face visit with our provider, whether that be an MD, a nurse practitioner, or a physician's assistant, following the interactive contact during that discharge period. We're going to take a quick break and do a little polling question to see how well we're paying attention. And you know what? I just realized the first polling question, I didn't actually address it yet on these slides. So let's go back one. So the services are provided during the 30 days beginning on the date the patient is discharged, and the service has to be performed 7 to 14 days following discharge. So the post-op period or post-discharge period is 30 days. The services actually need to be performed 7 to 14 days after discharge. There are 2 codes, one code for the 7-day visit and one code for the 14-day visit. We're going to come back to polling question 1 after we talk about the billing requirements, because I think you'll be better prepared to answer it then. So who provides transition of care management services? Physicians, certified nurse midwives, clinical nurse specialists, nurse practitioners, and physician assistants. So all of those providers who can bill under Medicare for preventative visits can provide a TCM service. And this is not to say that it's only the primary care physicians or primary care providers. It can be any provider, any specialty. Here are the billing requirements. As I mentioned, we have 2 TCM codes, 99495 and 99496. 99495 is the TCM service within 14 days of discharge. And you'll also notice that this service is for patients with moderate medical decision complexity. So that reimbursement is slightly lower than the 99496, which is TCM services within 7 days of discharge. And you'll notice that this requires high medical decision complexity. So a couple requirements here. There's only one TCM provider that may report services during the 30 days post-discharge period. Only one. So if my PCP calls me up for a TCM visit and I accomplish the visit on day 4, and then my cardiologist calls me on day 7, I'm still within the 30-day window. I'm still within the 14-day window to bill for the 99495, but I've already received a TCM visit from my PCP, so I can't, the cardiologist cannot bill for one now. So the services can only be reported once per patient during that period. The required face-to-face visit cannot happen on the same day as discharge. So that's why we're given 2 business days from the discharge date to make interactive contact with the patient, and then we have 7 to 14 days to actually accomplish the face-to-face visit. We cannot bill TCM services that are within the post-op global period. So if I go in for a knee replacement and my global period for that surgery is 90 days, then I cannot bill a TCM during that 90-day period. There are also a few other codes that cannot be billed in addition to the TCM code. Those include care plan oversight services, the home health or hospital supervision codes, end-stage renal disease codes, and chronic care management. And we'll focus on that last one in the next webinar series. Essentially what that means is you can't bill 2 preventive service codes in the same month. So if I am a chronic care management patient and I'm getting my monthly 20-minute chronic care management call, I'm billing for that call. If I'm admitted and then discharged, I cannot bill both a transition of care management and a CCM during that same 30-day period. It would be advantageous to bill the transition of care management, and also arguably clinically more sound, because I'd rather have the patient come in to see me after a discharge rather than simply doing a phone call, but we can only bill one or the other. And then an additional thing to note here is that services provided on or after January 1st can also be provided through telehealth. So if you have the ability to do telehealth in your organizations, these transition of care management codes may be billed as telehealth visits. So now we'll take a pause and do a quick poll. The question is, how soon after discharge should the face-to-face visit take place? Options are 10 days, 14 days, 7 days, or 7 or 14 days. Give everyone another 10 seconds to answer. Awesome. You all are pros. Right, 7 or 14 days. TCM services can be billed at 7 or 14. Reminder that the 7-day code is a slightly higher reimbursement, and we have to have high complexity medical decision making. Awesome. Let's take a peek. So I apologize for the fuzziness of this image, but this is actually a screenshot of the AMA CPT book for 2018. The Transitional Care Management services are on pages 52 and 53 if you all use those books. And what I wanted to show you here is that there are little stars to the left of both of these codes, and those stars indicate telehealth. So it means that you can bill these services under telehealth if the insurance carriers that you are billing accept that. I also want to note that there are lots of guidelines listed in your CPT book for you. So please reference those as you're billing out these codes. It's going to list all of those billing requirements that we just went over, in addition to other codes that you cannot report at the same time as you report TCM services. Let's jump to our second and final polling question before we dig into documentation requirements. How many providers can report TCM services within the 30 days post-discharge period? We have options of 2, 1, or all of the above, both. All right, we'll provide 5 more seconds. Excellent. Only one provider can report TCM services within the 30 days post-discharge period. Excellent, excellent. So this just encourages coordination of care amongst the patient's providers, and also if you're the primary care provider, really being proactive with getting that patient in for their TCM visit. The documentation requirements for this visit are as follows. The discharge date has to be in the patient's medical record. In addition to interactive contact date. So when did the physician office make contact with the patient? The date of the face-to-face visit, and then of course, proper documentation to prove complexity of medical decision-making. Really important to note here, if the patient is discharged and then readmitted within that 30-day period, the TCM visit will not be reimbursed. So that is why these dates are so very important to have in your medical record. It used to be that you actually couldn't even drop the bill for a TCM visit until that 30-day period was over. They've changed that now, so it makes it easier for us on the provider side to go ahead and submit that claim. But if the patient is readmitted, you will not get reimbursed for the claim. And if these dates are missing, you will not get reimbursed either. So very important that the discharge date, the interactive contact date, which reminder has to be 2 business days after discharge, and the face-to-face visit date are all very clearly spelled out in the record. Our favorite swim lanes, transition of care management workflow. We believe in swim lanes. We believe that preventive services are a team-based care activity. So we've put together this beautiful workflow for you to go through by role, how each person in the office is participating in this patient's care and specifically in the TCM visit. From a front desk perspective, the front desk is either going to be notified via a health information exchange like CRISP or receives a discharge summary for the hospital. Ideally, you'll see in the second box as a best practice, someone in your office is checking a CRISP report, CRISP being the Maryland HIE, daily for ED and hospital discharges. The information that comes out of our health information exchange is rich and very operational. It tells you who has been in the hospital for what and how long. If this is checked daily, it allows us to stay on top of scheduling patients for those transition of care management visits. So after they've been notified via the HIE, or they went in and they checked on the online portal, or they received a discharge summary from the hospital, they're going to call and schedule a follow-up with the patient within 7 or 14 days after discharge. And then they're also going to schedule their next routine visit with the PCP. And we include this up here because ideally, once the provider has seen the patient for their TCM visit, they should be scheduling a follow-up with the PCP right away. Because obviously if there was a condition that caused an inpatient stay, we want to proactively manage that and stay on top of it. So the nurse or medical assistant is going to attempt to call the patient within 2 days of discharge. And then once the contact is made with the patient, the nurse or the medical assistant would assess the patient's status and also verify that the patient has obtained medications and is taking them as prescribed. Once the patient has come into the office, you'll notice the color change here. The nurse or medical assistant will review details of the inpatient visit with the patient and caregiver and also record it in their chart, perform a medication reconciliation, and review the discharge instructions with the patient. So if I'm the patient in this scenario, I want to make sure I bring educational materials that I received in the hospital and also bring any questions that I might have about my care. Then the provider will see the patient and follow up on any pending treatments and diagnostic tests, communicate with specialists, and help coordinate follow-up visits as necessary with those specialists, provide any education to the patient or caregiver, also provide referrals for community resources as needed, and then send the patient home with a care plan and confirmation of discharge instructions. I know that many of my grandparents have been in the hospital and been discharged and have no idea what their discharge instructions mean, how to sort of what they need to do as soon as they get home. So this visit is incredibly helpful for those patients to have a chance to review it with their primary care provider, the provider that knows them well, and can offer a clear care plan and an interpretation of the discharge instructions for them. So at this time, we'll pause for any questions. I think I saw a few come in throughout the presentation, so I'm going to open those up. And just a reminder, feel free to chat them in if you have any questions. So I have one here. Does the required face-to-face visit have to happen in the provider's office? The answer is no. It can happen via telehealth. We saw in the CPT book that little star to the left of the code, which indicates that if the insurance company accepts telehealth visits, you can perform a TCM visit via a secure platform. Take a pause here for any other questions. Okay, great question. What documentation is required in the note for the follow-up phone call? So I think you're talking about the phone call within 2 business days of discharge. And the documentation that is required is the date that you got in touch with the patient, the fact that you spoke to the patient or caregiver or attempted to, so you left a voice message, and the fact that you discussed with them that they had been discharged from the hospital, that you'd like to bring them in for a visit, and that you scheduled that visit. That is sufficient for documentation for the follow-up phone call following discharge. Most important in that is the date that you were able to have that interaction and the fact that you acknowledged they were discharged from an inpatient setting. Any other questions? You all did so well on the polls. I think you're probably pros already. Do you have to be a PCP to bill for TCM? No, you do not have to be a primary care provider. It's any specialty can bill for a transitional care management visit. Okay, and what happens if the patient is readmitted before the 30 days expire? If the patient is readmitted before the 30 days expire, the TCM visit will not be reimbursed. CMS will make that decision, and it's the intention of the visit is to reduce readmissions. So once the patient passes through that 30-day window, the TCM visit is reimbursed. So let's say I get discharged on day 31, I'm readmitted, I can still bill for that TCM visit. Great questions. I'll hang on the line for a couple more minutes to see if any more questions come through. All right. Not seeing anything else come through. Well, you have our email addresses up there on the screen. If anything comes to mind, please feel free to shoot us a note. Thank you very much for joining us. We've enjoyed this series so far. We hope you will join us next week for chronic care management and share the recordings with your colleagues. Thanks again.